The other day I came up with this question about planned preventive measures, activities by local councils.
Yes.
Why are only 32% carried out of the total plan? So you put your stuff into a flurry. So maybe you could explain on that.
Yeah, because that caused a lot of concern. But basically what you're saying is that 32% is actually the proportion of expected gotong royong carried out in the hotspot areas. Because there are many preventive measures that we take. One is fogging, but fogging is just to kill the adult mosquitoes. It doesn't last very long, and it's only a temporary measure. So if we don't get rid of the breeding site, new mosquitoes will come up. So it's more important for the community to make sure that there are no breeding sites for these mosquitoes. So that's what we meant by encouraging our people to do this community or gotong royong activities. But to our horror, only about 32% of the hotspot areas reported the gotong royong activities, and that's why we are a bit concerned. I mean, the Ministry of Health has spent a lot of money to educate the public. We had this war against dengue. We had media campaigns in January 2009 when we first got the alert that dengue is coming up. But unfortunately, despite all this, there hasn't been much, or rather lukewarm response from members of the public, and the government has spent close to 12 million ringgit for just educational and awareness campaigns. But the rakyat kita, they don't seem to get galvanized into helping themselves. They think if you fog, problem solved. No, fogging is just temporary measure. And most of the cases of dengue, we find that the culprits are actually in the premises of the homes. They're in the homes, most of these breeding sites. So you can imagine, if we can actually get rid of breeding sites, we can solve 70% of the problem of dengue. I mean, in terms of transmission of the disease.
You have come up with pamphlets,
yes,
booklets, and you have come up with advertisements, I think,
advertisements, educational campaigns, pamphlets, going on road shows, and then also alerting the healthcare providers how to manage dengue, how to recognize the danger signals, who are the ones that should be admitted, who are the ones who should be watched carefully, what are the things to do when they get admitted. All sorts of things we've done, including updating our guidelines and all that. But well, it is not a Malaysian problem alone. Like, we acknowledge that it is a global problem with global warming and the change of weather and all that. But still, if it gets down to it, it all boils down to public apathy in terms of trying to help themselves. And also doctors also, we are trying to tell the doctors, some of them are not very happy when I said this, but very few of them have reported cases suspected dengue to us. If they had done so earlier, then we can take preventive measures earlier. And during that period that they don't inform us, can you imagine the number of mosquitoes floating around and biting people and getting people affected with the disease? So what we're saying is, the moment you suspect, you inform the health office, and we will initiate measures within 5 days quickly. That we can do. And we're also telling the doctors, you see, sometimes the clinical features of dengue and dengue hemorrhagic fever are similar initially. So the challenge for the doctors is to identify who are the ones who need to be admitted. Because sometimes they come with, the symptoms are more or less similar to any other illnesses, like having high fever and all that. But with dengue, not only do you get high continuous fever for 7 days, you have myalgia, you have body ache, you got joint aches, you get flushes, and of course, if you have dengue hemorrhagic fever, then you have bleeding manifestations and all that. Of course, the patient comes with bleeding manifestations, that's not a problem. They get admitted straight away. That is not the challenge. The challenge is when the patient comes with just fever, joint pain, rash, and maybe minor bleeding spots. These are the patients perhaps that you should admit and monitor them very closely, because the 24-48 hours when they are admitted are critical. This is when they can run into a lot of problems, and the treatment is not difficult if patients come early. If patients come late, treatment may be difficult because all the complications has already set in, so there's not much the hospital can do. But if they come early, or the doctors refer them early, then there's a lot we can do. We can watch out very carefully for all the danger signals. And once you pick up the danger signals, you already started the patient on drips and all that. And with that, you'll be able to save their life. Because basically, dengue hemorrhagic fever is leakage of the plasma out of the endothelium, you know. So what you need to do is replace the fluids, basically. And if there is bleeding, you replace them with platelets. That's all you do. There's no magic bullet. But speed is of the essence.